Today I will be discussing the horrendous heroin epidemic that is happening today all around you. I have been interested in this topic and have done extensive research because of how badly this epidemic is affecting the loved ones around us. According to drugabuse.gov, the alarming increase of prescription drugs being prescribed has increased the negative abuse among people, leading to opioid abuse problems. Prescription opioids act on the brain the same way as heroin and morphine act, which leads to abuse of these other drugs when the addict is trying to get the same high. According to the New York Times, the state of Ohio filed a lawsuit on the drug makers of opioids, accusing many drug companies of not correctly informing doctors and patients of the dangers of overdoses and addiction. The number of unintentional overdoses has more than quadrupled since 1999, according to drugabuse.gov. The numbers are continuing to rise, and I believe something needs to be done. Today, I will inform you on the effects of prescription drugs, the heroin epidemic in surrounding Ohio counties, and ways in which we can try and end the high number of people with opioid addictions. Moving on, I will begin to discuss the potential effects of prescription painkillers. Prescription drugs are being prescribed much more often than have been in previous years. According to drugabuse.gov, several factors contribute to prescription drug abuse, such as drastic increases in the number of prescriptions written and dispensed, greater social acceptability for using medications for different purposes, and aggressive marketing by pharmaceutical companies. Escalating from 76 million in 1991 to 207 million in 2013, the number of prescriptions for opioids are continuing to rise, which may often lead to non-medical use of opioid abuse. Because prescription painkillers and opioids act the same on the brain as heroin, especially if they are used for non-medical reasons, it often leads to an intrinsic abuse of heroin and other drugs such as fentanyl. Here is a picture of a commonly used prescription drug called Percocet that often leads to addiction of heroin abuse. Next, I will go on to inform you of the alarming number of fatal overdoses in surrounding Ohio counties. You may not realize the impact that heroin has on the communities around you. However, the numbers have become alarming. According to the Washington Post, because of the sweeping numbers of fatal drug overdoses, Stark County morgue has become too full and required a trailer from the state to store more bodies until it gets caught up. A man involved in public safety for several years from Akron, Ohio, recalls the drug problem in the late 60s and early 70s. However, the number of fatalities today are, quote-unquote, nowhere near close to this. According to state-by-state statistics compiled by the Henry J. Kaiser Foundation, 2,106 opioid overdoses were reported in Ohio in 2014, which was 7.4% of the 28,647 deaths reported nationwide that year. California ranked second with 2,024 deaths, and New York was third with 1,739. To conclude, it is obvious that the heroin outbreak is a huge issue that is taking people's family, friends, and loved ones away too soon. According to this graph that I found on CDC, 4 to 5 heroin users previously used prescriptions non-medically. Next, I will go on to discuss measures that are being taken to reduce the number of fatal overdoses and becoming an addict in general. Education, drugs that reverse overdoses, rehabilitation centers, and medical guidelines are ways in which we are acting against addiction. Naloxone, which according to usnews.com is a drug that immediately blocks deadly respiratory suppression caused by heroin. It's available as a nasal spray for the families and friends of users to help reduce an overdose. Television ads, social media, and radio have all been used as methods to educate people about the dangers of addiction. Rehabilitation and drug treatment programs are becoming more easily affordable and accessible for those addicts and families who need help. As you can see, steps are being taken to help limit the number of fatal overdoses with hopes of diminishing the epidemic. Fentanyl is you shake it, then you proceed to call 911, and then you give the naloxone to the person that has overdosed with hopes of reversing it. Now I will recap on everything that I just covered with you today. The current heroin epidemic is affecting many people and their loved ones all around you. Something needs to be done. Prescription painkillers are being prescribed way too often. Doctors are starting to decrease the dosage when prescribing to patients. According to OverdoseLifeline.org, this is not about drugs. It's an educational program that has been implemented by the Anthem Foundation that educates thousands of students about misusing opioids and avoiding the first-time use. Ohio pharmacies are now dispensing naloxone without a prescription for addicts and their friends and family to stop an overdose. The number of fatal overdoses are continuing to rise. However, with the right treatment and education, they may begin to fall. Heroin is an evil substance that causes distress and damage among the addict and his or her family and friends. Prescription painkillers have many harmful effects if not used properly and could lead to addiction. Ohio has one of the highest rates of drug overdoses in the county. With the help of education, addiction centers, rehabilitation centers, and drugs such as naloxone, we have high hopes of the high numbers of fatal drug overdoses to fall. Addiction is a terrible disease that causes much distress and damage among the user and his or her family. Once it hits close to home, you have a better understanding. However, hopefully after learning from me today, it will have a greater impact on you as well. There's 3 things that need to be done in order to stop this horrible epidemic. We need to prevent people from starting to use heroin, just reduce heroin addiction in general, and reverse the heroin overdose with the help of the naloxone medication. Thank you for listening, and I hope you have a better understanding.